Hello friends, my name is Imran. I'm an intern in Government Medical College. So today we are going to discuss about the anatomy of bronchopulmonary segment, which is a very important topic in anatomy. Starting with the basics, what is a bronchopulmonary segment? It is an anatomic, functional and surgical sector of the lung, and it is aerated by the tertiary bronchus. We have to remember it, and it is pyramidal in shape, and the apex is directed towards the root of the lung. This is a diagram of a bronchopulmonary segment. Now moving on to the details of the bronchopulmonary segment. As we can see in the image, we can see two bronchopulmonary segments, and in the intrasegmental we have the bronchial artery. Tertiary bronchus. As we know that the bronchopulmonary segment is aerated by the tertiary bronchus, and we have the pulmonary artery segmental branches. In intrasegmental we have these three, and in intersegmental between two bronchopulmonary segment we have pulmonary vein, tributaries of a pulmonary vein, also called as intersegmental vein. A bronchopulmonary segment is not called as bronchovascular segment because we do not have a pulmonary vein inside the bronchopulmonary segment or tributaries of pulmonary vein. Moving on to the bronchopulmonary segments of the right lung. As we already know, there are three lobes in the right lung: upper lobe, middle lobe and lower lobe. The total number of segments in right lung is 10. Starting with the upper lobe, we can see in the images, the first one is the lateral view and the below one is the medial view of the right lung. In upper lobe we have three segments. The first one is the apical, and the second one is the posterior segment, and the third one is the anterior segment. In middle lobe there are two segments: lateral, the fourth one is the lateral segment, and the fifth one is the medial segment. In lower lobe there are total of 5 segments. The sixth one, that is the superior and also called as apical. The sixth one is the apical or superior, and seventh one is the medial basal. The medial basal is not seen in the right lateral view. We have to see that in the right medial view. It can only be seen on the right medial view of the right lung. And the eighth one is the anterior basal. Ninth one is the lateral basal, and 10th one is the posterior basal. As we already know, there are total of 10 segments in the right lung. For memorizing the image, we have to memorize only the right side, and we have to make it opposite diagram in the left lung. Now moving on to the bronchopulmonary segments of the left lung. As we already know, there are two lobes in the left lung, upper lobe and lower lobe. But in right lung we have 3 lobes, and the total number of bronchopulmonary segments can be 10, 9 or 8 depending upon the total segments, and the most commonly found is total 10 segments are found in the left lung as well as the right lung. In upper lobe we have the apical, and the second one is the posterior, and third one anterior, and we can see the superior lingular and inferior lingular on the left lung, bronchopulmonary segment of the left lung. In lower lobe we can see superior, sixth one is the superior, and the seventh one is the medial basal, anterior basal, eighth one, and ninth one is the lateral basal, and 10th one is the posterior basal. You can just remember as MALP, M-A-L-P. The total number of segments in right and left lung is 10, but in left lung the medial basal can be absent in some individuals, so in that case we can have 9 segments. But in some cases we can see the medial basal and anterior basal are fused, so they can be 8 or 9 depending upon the total segments of the left lung. Now moving on to the dependent bronchopulmonary segment. In standing position, the posterior basal of the lower lobe of right lung is the most dependent bronchopulmonary segment, and in supine position the apical or superior of lower lobe of right lung, that is the sixth one. Thank you for watching. Make sure you hit the like and subscribe button for more videos related to medical field.